Good morning, all MBBS fourth year student. So today, uh, this session will be run by Emergency Medicine Department. Last time we discussed a little bit about snake bite, and there are few questions remaining upon the management. Like I just want to repeat some of the things that this is one of the most important medical emergency in our country, especially in this season. So I choose these topics for your class, and this is included in your curriculum. I don't know whether you have already gone through this or not. Even though you have not gone through, it is better to repeat once again. And this epidemiological part and the background I already covered in the previous class. And in that class, what I have told you that National Protocol on Snake Bite has been developed by Ministry of Health, and it has covered so many areas that it is easy for us to follow that protocol. I just want to show this guideline once again, that this is a national guidelines for snake bite management in Nepal, and it has included all the requirements necessary for the initial identification, initial management, sign and symptoms, and first aid, pre-hospital treatment, hospital emergency treatment, and subsequent how to differentiate between poisoning and non-poisonous snake bite. What are the different types of complications that may occur during identification and treatment? What are the laboratory investigation, and how we should these snake bite patients when they come to, especially in emergency department, and how you should monitor the patients, and how you can manage the critical condition and discharge the patient when it improves with the treatment. And there are some other guidelines developed in this part, WHO, because our SARC region is one of the very much vulnerable place. It's a highly prevalent place for snake bite patients. We, in the daily newspaper, you may have heard that many patients could not reach the hospital due to lack of access to healthcare facilities. And there are so many other social and economical issues regarding the snake bite. And one of the important constraint and barrier to get access to the healthcare facility is this transportation facility, especially at night. And they don't have very good linkage or access to the ambulances, or the transport facility may not be available when they need it. And another is they don't know where to go. And when the anti-snake venom is available, so they go to one center, and the anti-snake venom is not available, and then from that center, the patient is referred to another center. So another important thing for your information is anti-snake venom is only available in government setup, and it is not available in the pharmacy, private pharmacy. So you must know that this anti-snake venom are only available in government hospital. It is not freely available, and patient cannot buy anti-snake venom in pharmacy like other medicine. That is the most important thing, why the patient may have some confusion if they get snake bite and they do not know why the snake bite is available. So the patient may go to another hospital where it is not available, and by that problem, patient may get delay in getting the anti-snake venom in the right time. That is the scenario in our setup. So this slides has been described in the previous class last week. These factors, snake bite management. I will be focusing on the anti-snake venom treatment and the possible complication today. One of the important thing you must know that all the snake bites, poisonous snake bite, do not result in venomous infiltration, no? Because it needs to be penetrated into the blood circulation, the poison. So it is called the dry bite. I have already told you that patient may be frightened and patient may have a panicky attack symptoms. So you must differentiate the anxiety symptoms and the symptoms that is related to the poisonous snake bite manifestation. Local presentation is most important, but some of the snakes, like parrot bite, they may not get any sign of bite marks and patient present without local symptoms, local presentation. So according to the different species, this local presentation varies. Cobra may have more local symptoms. So viper bite may have profound local symptoms, and parrot may have no local symptom or bite marks at all. So that is the symptoms may be different. It depends upon the types of species. The local symptoms by viper bite, general symptoms. General symptoms is important because when you see the patients in emergency, you may think that if the patient's history is not so clear and they do not know what happened, especially at night, a cobra bite results in the daytime and when the patient is active, but the cobra bite results in the nighttime, and patient may bite the patient when they are sleeping, and they may not produce any pain during bite, especially if they are sleeping. So the patient may come to hospital with general symptoms like vomiting and abdominal pain. So sometimes it may be very difficult to differentiate all the symptoms of snake bite with other general health condition. So it may require some of the experience and training, and the history is very important, that what person was doing before these symptoms occurred, or is there any linkage of some other disease, or it is related to snake bite. So you may have to ask in detail to differentiate the early symptoms of snake bite with other general condition, because it may result in systemic manifestation. The symptoms may have sometimes it's a combined form of presentation, like in cobra. It may result in neurotoxic features, and sometimes it may have little bit of hematological symptoms. So patients may present in a hospital with various forms of systemic and local complications. Which I have already told you in the last class. Neurotoxic features. There's so many neurotoxic features. Is one of the very most important presentation in the snake bite in our part. Bleeding. It is so severe that you may not see all these bleeding features in a patient in one time at the time of presentation, but patient may have a bleeding tendency. If the patient presents in the early stage, you have to send some of the important laboratory parameters like bleeding time and clotting time. CT. Clotting time is very important. INR is very important. So clotting time is another important parameter. If it is more than 30, we have to continue treatment with anti-snake venom. This is the local treatment. Just I want to show you once again. The reassurance is very, very important because patient is frightened and anxious, and patient may apply some of the harmful application to the own side, like application of tourniquet, incision, soaking, and very tight tourniquet, and that may lead to gangrene, ischemic gangrene later on. Even the most problem is if the snake bite is non-poisonous, people try to apply a very tight tourniquet in upper limb or sometimes lower limb, and the limb have to be lost due to ischemic gangrene, and many patients have resulted as amputation due to ischemic gangrene in non-poisonous snake bite. So now this tight tourniquet has not been recommended. So this is a part of education, it's a public health education which we have to disseminate to the public. In immobilization, sometimes patient may run from one room to another, patient may cry, and patient may seek some of the medication himself. The best part is if you have mobile, you have to take help of your family member with the help of mobile, or you can shout and rest in one area, and you have to advise patient not to move from one place to another or not to mobilize even upper limb also. So you can apply a armrest, for example, a splint or sling, especially at home. So you can advise a shawl or to use as a sling or bandage. And it's important is rapid transport. In our part, various transportation has been recommended in the rural area. Motorcycle is the most important means of transportation, and many studies have shown that motorcycle ambulance, the concept of motorcycle ambulance, has been popular in the rural part of India, Pakistan, Bangladesh, even in Nepal. Motorcycle ambulance, how it is used is the snake bite patient has to be sit in the center. Three people has to ride in the motorcycle. The front is driver, the middle part, this patient will sit in the middle, and a healthy person who has not bitten has to sit in the third seat, supporting the patient in mid, which is sitting in between. So that patient can safely transfer from home to hospital. But in many areas now ambulances are available in our part in Chitawan and neighboring district. So the problem is patient may not have ambulance number when it is necessary. So patient's time may be waste to find out the number, a telephone number of ambulance. So it is always better to keep a telephone number. In the developed country, what we call a very easy telephone number, 3-digit telephone number in case of emergency ambulance, to call emergency ambulance. But in our part, it is not still popularized. And in snake bite, it would be nice if our country have a very easy 3-digit number to call ambulance in case of emergency. Antivenom, particularly I'd like to talk about antivenom today. Last time I could not have, I don't have much time to explain about antivenom. Antivenom are the antibody capable of neutralizing the effect of venom. So I already told you antivenom are supplied by the government and to the government institution. So it is not available in private hospital and private pharmacy. So you cannot buy antivenom in the market. So you have to, why it is so? Because anti-snake venom, so it is, I can't interact with you right now, but if you want, yes, if you are in face-to-face class, so we could have interaction, because anti-snake venom is not available in pharmacy or private hospital. So why? Probably it is supplied in the country in limited number by the suppliers, even by the government authorities. They buy this anti-snake venom, and they keep a proper record system, because it needs a record system. Who was using this anti-snake venom, how many anti-snake venom has been used for the particular person. The inventory has to be maintained and submitted to the government. So why it is so? Because if it is freely available to the private practitioner in a smaller hospital, patient may be panic, and even in non-poisonous snake bite, patient may be treated with anti-snake venom. That is one of the chances of misuse of anti-snake venom. One thing. Another thing is anti-snake venom are antigen. So say antibody. So it may produce antibodies. So it may produce hypersensitivity reaction to the human body. So one of the main dangers of anti-snake venom is it may produce hypersensitivity reaction or severe hypersensitivity reaction or anaphylactic reaction. So we have to keep anti-anaphylactic salve treatment treatment management plan when we are treating patients with anti-snake venom. These are the two prerequisites. You should be prepared for a resuscitation in case of patients develops severe hypersensitivity reaction with anti-snake venom. Now, this is a foreign protein, It's many enzymes, proteins are made of the composition of this anti-snake venom. So this long list is difficult to remember. If you want to know in detail, you can go through these different types of protein enzymes, which is composed in this venom. So in Nepal, so this is one of the common, problem. So I have already told you some of the generalized features, but in cardiovascular condition, the patient may have a collapse, shock, arrhythmia, pulmonary edema, congenital edema, and visual disturbances, dizziness, fainting. This is a cardiovascular complication. I already told that bleeding, bleeding disorder. These are the few steps I have already told you in between in the previous slide. So, syndromic approach, I have already explained this one. Syndromic approach means it is very difficult to find out a classical laboratory test in case of snake bite, or is laboratory facility may not available at night in the peripheral center like PSC or health post. So you can start treatment on the basis of syndromic approach, like local envenoming with bleeding or clotting disturbances. You may suspect it is a Hypersensitivity. A Hypersensitivity means if you have a specific anti-snake venom, but in our part it is not. The anti-snake venom are polyvalent, means it acts against all major types of snakes like vipers, cobra, crate. So, but in some countries there are specific anti-snake venom. Like if the patient is bitten by viper snake, this specific viper anti-snake venom is given. But in our part, it is not a specific anti-snake venom, but it is a polyvalent anti-snake venom. It is useful to all types of species. But if you want to identify particular type for the specific management, you can approach by syndromic clinical approach. That means syndrome 1 means local manifestation with bleeding disorder, means a viper snake bite. Syndrome 2 means local envenoming with bleeding, clotting disturbance, acute kidney injury, Russell viper bite. Now, this is common in India and Sri Lanka. Now, this side, local swelling with paralysis, cobra, king cobra, paralysis with minimal or low local envenoming, bitten on the land while sleeping on the ground, correct. This is in syndrome 4, I think it is the most common snake bite poisoning in Nepal, 3 and 4 in Nepal and Uttarai region. This is a South Indian, is a Russell vipers in Sri Lanka and South India, Bangladesh, land in sleeping indoor. This is in the Tharu community, like India is in Nepal is inner Tarai and Tarai, even in the hilly region, some of the hilly region current is found. And so snake in bitten in the snake. See, we don't have C, so it's not found in our part. Long-term complication assessment, first aid. So sometimes you may waste time in assessment of snake, but for useful question in the initial part is what part of your body have you been bitten. So patient may give the answer properly if there is a clear-cut fang marks, and a patient may see the snake biting them, or even they can kill it, chase it for killing. So sometimes the history is clear, sometimes under when and under what circumstances you are bitten, means in the home, in the field, in the sea, inside the water, you know. So that make some of the clue for your diagnosis. Now, investigation. The most important investigation is coagulation screening. This is for this patient with coagulation disorder and kidney injury, even ECG, early features. Right? These are the early features: hypotension and shock, nausea, vomiting, diarrhea, severe headache. Now, ophthalmoplegia, ptosis is the clue. If you are very particular to see the neurological features, ptosis and ophthalmoplegia, very useful clinical tool for the evaluation. Apart from this, general symptoms like nausea, vomiting, diarrhea. These are the very general symptoms: vomiting, diarrhea, nausea are general symptoms of shock. But particularly if these patients have features of shock and ptosis and ophthalmoplegia, probably you can catch the diagnosis of snake bite in that early stage. And in bleeding, systemic bleeding are little bit late. Sometimes if the viper bite is very severe, symptoms may occur early stage, starting around 15 to 30 minute time of bite. General examination is as a routine part. You have to see all features, focusing on the hemorrhage and the neurological manifestation. And this snake venom. So, just I'd like to share the indication are very important. You know, when you start anti-snake venom, probably a senior doctor in the team will decide whether this, like the number one is to differentiate between poisonous and non-poisonous snake bite. So you have to observe in between, because if you label it a poisonous snake bite, probably you need a snake venom. And if you are labeling it a non-poisonous snake bite and patient may not develop any features, and you are observing the patient in emergency department or sometimes in the medical ward, the patient you have to observe the patient at least for 24 hours. No, 6 to 24 hours. The safe practice is all the snake bite patient has to be observed for 24 hours. So the safe practice is that, because sometimes the patient may develop a late manifestation of snake bite poisoning feature. So the safe policy is to keep the patient in observation for at least 24 hours. The dose, there are different thoughts: low dose regime and high dose regime. And low dose regime means if the patient are not developing a severe toxicity, and the low dose regime has been recommended. But the most important thing is, the most recommendation is patient usually, if the patients have severe neurotoxic features and the patient is having a respiratory paralysis, we don't like to wait with the low dose regime. Typically, the best was the most of the they recommend that this 10 vial IV over 1 hour and 5 vial IV 6 hourly, or up to 30 vial. And you have to monitor a clinical improvement and laboratory improvement. In laboratory, one of the very much useful tool is clotting time. If the clotting time is more than 30 seconds, we have to continue into snake venom. If the clotting time is decreasing or near normal, we can reduce the dose gradually. Patient may need, in general, 30 vial for poisonous snake bite treatment, but it may take a less number or more, depends upon the clinical and laboratory response by the treatment. Hypersensitivity reaction. Hypersensitivity reaction is on as I have already mentioned you, hypersensitivity reaction, and you have to assume that all the patients may develop hypersensitivity reaction during anti-snake venom treatment. That is the principle of treatment. You have to keep at least 3 things ready. One is, you have to very much watchful about the clinical feature of immediate hypersensitivity reaction after starting anti-snake venom. This immediate features may be rash, itching, and decrease in blood pressure. If it is too much, is unconscious. So if you are not aware of this anti-snake venom, you may think that decreased blood pressure and unconsciousness is due to snake bite toxicity. So you have to be very much watchful of rash. Unconscious patient cannot complain about itching, even they cannot complain about rash. So you have to monitor the blood pressure and like other vital sign like tachycardia. If there is unexplained drop in blood pressure, increasing in tachycardia, patient may not complain about itching. You can observe the rashes in the skin. So you have to very watchful to observe whether the patient is developing a rash or not. So you have to keep 3 things ready. Adrenaline is one of the most important drug to treat hypersensitivity reaction. You have to give adrenaline. It is better to give IV, but IV adrenaline can cause tachycardia, and you can give instead a subcutaneous route. And you can usually give subcutaneous, you can pinch the little of skin. So you can give in subcutaneous instantly. So you don't have to wait much time on discussing or consulting so many people about whether it is a sensitivity reaction or not. Don't waste time in consultation or deciding. If you think that it is a hypersensitivity reaction, you should give adrenaline immediately. Don't waste time to develop a full picture of hypersensitivity reaction. So adrenaline is not is one of the safe drug when you give with IM or SC route. IM route may cause sometimes tachycardia or BPC. So is subcutaneous route is safe and it acts in a reasonable time. So if you are not comfortable with subcutaneous route, you can give with the intramuscular route. Now, hydrocortisone is steroid. Keep hydrocortisone ready. Now, it may take some time to act, but it acts on subsequent. After a few minutes, it is effective against hypersensitivity drugs. And another is chlorpheniramine maleate. So you have to keep ready 3 drugs: adrenaline, hydrocortisone, and antihistamine drug before starting anti-snake venom. Some of the doctors even they give hydrocortisone and chlorpheniramine before starting anti-snake venom. Response to anti-snake venom. Now, the patient's clinical improvement, you can observe the patient feels better. Now, patient, this is a general improvement. Patient feels better, like nausea, vomiting, and it's generalized ache and pains disappears quickly. Spontaneous bleeding will improve. No? Like 20 WBC and whole blood clotting time. No? In the remote area, even in our hospital, we can test blood coagulability in bedside. This is a bedside test, not in the lab, right? Like you can read in detail what is 20 WBCT. So you can ask in short note or in Viva what is 20 WBCT. It is it's a test for blood coagulability, and it's a bleeding from new or partly healed wounds usually stops. If we start anti-snake venom, it will improve whole blood clotting time. So whole blood clotting time. Shocked patients' blood pressure tends to improve after there is a very good response with anti-snake venom. Neurotoxic envenoming begins to improve as early as 30 minutes after anti-venom. No? The patients, the most important thing is you have to explain the patient, If you know this timeline, you have some confidence to explain the things to the patient. Counseling is not only diagnosis, but you have to explain the things, how anti-snake venom is acting, what time that it shows some signs of improvement. Some features improves in 30 minutes, some features improves in 1 hour. No? If you know this fact, it makes you easy to explain with this patient's party for during the time of counseling. These are the important things which I have left in a last class. So I request you to read snake bite poisoning in detail, not for the importance of exam, for the purpose of your professional development. Later on, you will be a doctor and you may be posted in this in the thoracic region or the inner thoracic region. So you may have to see such patients, and you may be the only doctor to see such patients when you are in duty. Please read it in detail, and if you can save life of patients snake bite, and if you can identify the snake bite patient on time, if you start anti-snake venom nicely, and if you can save these patients, you will have a great job for the patient and for that victims. Family are worried, and at night time they don't have much time to consult here and there, and so it is a very much rewarding if you can save a patient of snake bite poisoning by your proper identification, proper treatment, proper monitoring. That would be one of the aim to be a doctor, if you can save a patient who are coming to hospital due to snake bite. So that is one of the aim of your career. So you should save the patient's life when they are in problem. Another is long-term complication. Patient may have local complications like gangrene and like compartment syndrome, gangrene, and blisters. So later on, this type of patients may need a plastic surgery for reconstruction and for cosmetic purpose and for restoration of function. So restoration of function of locally affected part is one of the aim of treatment, and apart from that, saving lives. So restoration of function of affected limb or cosmetic restoration of skin, if it is possible by plastic surgery or the late modality of treatment. Yeah. So I ask you, I request you, go through the curriculum, go through your textbook, and the national guideline developed by Ministry of Health is extremely valuable guideline developed by the Ministry of Health by a team of doctors who have spent their time in snake bite management. You can download from the website of the Ministry of Health, so you can read it when you are free. So if you have some queries, you can ask me. Otherwise, the time is up. So you can meet me in the department if you are free. Anytime, if you are free, you can contact me regarding snake bite management in emergency department. Thank you for your time and listening.